Hi, this is Dr. Rob with our this week's health blog, and this one we're going to talk more about the question really is, do you have health insurance or do you have sickness insurance? So the question really is that when do you really use your insurance? Is it when you're healthy or when you're sick? So most of us are going to answer hopefully is when you're sick, of course. So when you have a problem, some sort of symptom is when you're going to use your insurance, and that's where it's going to pay for a problem. So it's not health insurance. So right off the bat, we should just relabel it so we don't get in our mind that the health insurance is, or the insurance company is supposed to bring us health. It's really just there for first aid or for when your body breaks down. So, which brings me to another situation here, which I just had happen today, is that we have in two particular types of sickness insurances called HealthNet and Pacific Care. Those two types of sickness insurances, they have contracted a specific group called Optimal Health, which is a managed care company, and the job of managed care companies is not to allow you to utilize your benefits really, because that's what they're hired for. So, so if you have a certain amount of benefits, for example, I was interviewed by the Optimal Health Managed Care doctor, and he was looking at my cases of people that had those particular insurances, and was telling me that according to the national average, that most people should come into a chiropractor for an average of 8 times. And he said mine was an average of 12 times. So, so he was saying that I was out of hand and I shouldn't be, I was overutilizing, over-recommending for that care. But now when we look at the fact of where they get their averages, it goes back a few years before that, where these insurance companies, actually what they did is that they used, they have specific procedures to where you have to fill out some information and you have to submit the information to the insurance companies with the care plan to determine if they accept the care plan for that particular patient, and you recommend a certain amount of care for certain conditions. So for example, I would put down what was more accurate for the patient. So for example, if it took them 20 visits or whatever to get over their symptom part of it, not corrective care, but symptom care, if it took about 20 visits, I would send that in and I'd always get rejected. And this is before they got their national averages, by the way. So what they were trying to do is I'd call up other doctors and they would have the same problem, until I found one doctor who said, just send it in for 12 visits, and then you can start from there, because you can try to ask for more later. So at least the patient can get some care, because otherwise the patient wasn't going to get any care. So then all these doctors found out about this, and they started just recommending less care up front, so the patient can at least utilize their insurance and get some care. And then, so then the insurance companies developed a profile and used all the profile there to come back, and if anyone went over that recommendation, then they would say you're violating, you're overutilizing. So that it's almost it's a strong arm method, but then a real sneaky method in what insurance companies on how that they were trying to show, just so they didn't have to pay for their care. So the thing that you should realize is that one is that the managed care system is not designed to allow you to utilize those systems. So I think that your best bet is to realize that, like for example, Optimal Health, which is the one managed care system, is really, if you want to try to get rid of these situations, you just have to get together and really try to fire the managed care systems, complain, and realize that they're not there for your best interests. So, so if you have questions about these things, because it goes much deeper than this than we're talking about, but this is just one instance that happened today when I was getting interviewed by the doctor, and this is what we have to deal with. So really, our hands are kind of tied as doctors because of the insurance companies manipulating statistics to show how they're justifying their utilization of care. So if you have questions about this, contact me at Bates Chiropractic. Our phone number is 310-545-4188, or you can contact us at chiropractormanhattanbeach.com. But other than that, just realize the last point I wanted to mention here, though, is that with our office here, is that we do corrective care. Corrective care is different than what will be paid for than acute care. There's acute care stage and then a corrective care stage. So the insurance companies will always only pay for the acute phase, never for corrective care. So keep that in mind, because once insurance allows 8 visits, then you got to shift into the corrective mode there. And if you have questions about that, just realize that we do have our fees are set up to where they're about 50 to 30% less than other chiropractors in the area, so you can allow to get in to get the care that you need. So any questions, give me a call or contact us at our website. Have a fantastic day. Bye.